Well, in a little more than a week since taking office, President Trump has signed hundreds of executive orders. One thing that has made many headlines is the order ending federal funding for sex reassignment surgery for minors. The order calls for several changes. Among other things, the government will no longer fund or promote any kind of sex reassignment surgeries or treatment for minors. It also calls on all agencies to rescind or amend all policies that rely on guidance from the World Professional Association for Transgender Health. And it calls on the Secretary of Health and Human Services to publish review of all available literature on the best care practices of minors who, quote, assert gender dysphoria. As regards sex change, a recent declaration from the Vatican states the human body shares in the dignity of the image of God. Such a truth deserves to be remembered, especially when it comes to sex change, for humans are inseparably composed of both body and soul. It follows that any sex change intervention, as a rule, risks threatening the unique dignity the person has received from the moment of conception. And joining us now to discuss is Beth Serio with the organization Do No Harm. She is also a registered nurse. Beth, great to be with you today. First, let me get your reaction to the executive order, and what, if anything, have you heard from parents?
We think that the executive order is, of course, an amazing, momentous occasion to celebrate in this fight against gender ideology. We're just so thankful for President Trump and his administration for taking this strong stance that demonstrates his commitment to protecting children. And, you ask about the reaction from parents, and I would say it's truly one of jubilation. Many people have been fighting for this for so long, have been trying to educate the public on the dangers of these sex change interventions on minors. And it's so great to now see true progress being made to end these interventions and put it behind us as a nation.
Yeah, Beth, what struck you the most about this executive order, and what do you think in this order will really have the most impact?
It's there's so much to this executive order that could be said, so many great things. But I think one of the biggest things for me is just the prohibiting federal funding of so-called transition procedures for minors through whether it's federal grants or health insurance and benefit programs. It removes the burden to the American taxpayer, whose tax dollars have been helping to fund these procedures for years. And we know that the so-called gender transition for minors is wildly unpopular with the American public. But for years, we were forced to help fund it through our tax dollars. And this executive order is saying that's not going to happen anymore.
Yeah, and that is a good thing for sure. And this is just one of several executive orders regarding transgender ideology that we know. What are some of the others? Talk to us about those other executive orders and really the significance of all of this.
Right. So, this is, President Trump has been obviously hard at work with many executive orders that just show his commitment to biological truth and defending children from and the American public, frankly, from the dangers of child sex change transitions. He's done last week multiple executive orders protecting against the Title IX and women in sports and women prisons. So this just shows, just a long, just one long stream of his of actions to show his commitment to protecting children.
Yeah, before I let you go, we're not a whole lot of time left, but in the executive order, the White House calls for all agencies to end any reliance on standards of care drafted by WPATH, that's the World Professional Association for Transgender Care. Talk to us more about this organization, maybe for those who don't know much about it, and quickly, if you can talk about some of those standards.
Sure. So the World Professional Association of Transgender Healthcare Transgender Health is an activist organization, is what it is. It's driven by their commitment to radical transgender ideology that pushes these procedures on children. So they're not motivated at all by the sound science that shows that there are very serious complications to putting children on, cross-sex hormones, puberty blockers, uh, surgical interventions. But the WPATH has long since ignored all of that sound research and instead just pushed children onto these procedures, even denying things like that a minimum age, saying that almost no age is too young to potentially be on this path. So we at Do No Harm think it is a really great thing we are going to end our reliance on WPATH as being a standard of care. It's not a standard of care, it's just straight activism, and we need science to be our standard of care.
Beth, thank you so much for weighing in. We really appreciate it. God bless.
Thank you so much.